So when I look at dental practice management, I look at three things. One is your business systems. You've got to have solid business systems in place in your practice so that you can do the dentistry. If your business isn't running smoothly and effectively, if it's not profitable, then obviously you're not going to be able to sustain yourself as a business in this environment. And where we have a lot of corporate dentistry and things like that in the environment now, it's even more important that your business systems are really fine-tuned and working properly. The second area is your practice growth. And if we neglect those systems, the systems that make us more productive, the systems that make our team work together cohesively in the clinic, providing excellent patient care, if we don't focus on those systems and make sure those are really fine-tuned, then we can waste a lot of time, we can be non-productive, we can have a chaotic schedule, all of which finally funnels down to a not so great experience for your patients and such that they don't want to come back to your practice. So having those practice growth systems are key. The third area that is vitally important for your practice and systems that are going to help your practice to thrive and be that ideal practice that you want is the culture and leadership components of your practice. If the culture is terrible, if there's drama and tension and stress with the team, that spills out to your patients. They feel it, they know it, something's not quite right in your practice, and they just don't get the best care that they could get. So making sure that your clinic, your culture is where it needs to be, that you have the leadership skills and an awareness of how you affect the team when you're in the office is vitally important. So now why do any of these systems get neglected? Well, it's because you're a dentist and you've been trained to be a dentist and to provide dentistry. You really haven't received any training to speak of on how to run a business. So when you're trying to be a clinician and you're trying to balance that with being a manager of your office, usually one of those is going to suffer as you focus on the other, and we tend to focus on the dentistry because that's what we're comfortable with, that's what we're the best at, so we focus on those clinical aspects. And because of that, typically the management side suffers and we see breakdowns in these various systems that we just talked about.